Hello, everyone, and welcome to our HIPAA and HITECH What You Need to Know webinar. Presenting for us today are three representatives from Shreddit who work with organizations every day to ensure they are complying with and staying up to date on HIPAA and HITECH. Before I pass it over to Shreddit team, I would like to pass on a few housekeeping items. For those of you connected via the web, should you experience any difficulties, you may locate a list of helpful resolutions to the most common issues by simply clicking on the Help button located at the bottom of your screen. If you're unable to locate the answer to your issue, you may also submit issues via the Ask a Question box located in the lower left-hand side of your screen, and a technician will reply to your question. For audio attendees, please report any issues by pressing *0 on your touch-tone telephone. Also, please note we will be having questions at the end of the presentation. At that point, our three panelists will be able to answer your questions. Please use the Ask a Question box at the bottom left hand of the event screen. For audio-only attendees, we do not have an operator ready to give you instructions on how to queue up for your questions. They will prompt you at the start of the Q&A portion. I would like to now pass it all over to our Shreddit team. One moment, please.
Welcome, everyone, and thank you for taking the time, your busy schedule, to join us for, depending on your level of engagement with healthcare information in the past, what will either be a primer or a reminder about HIPAA, HITECH, and what you need to know. Joining me today is Chris Sheehan, the Compliance Officer for Shreddit's Providence branch, as well as David Pinter, the National Account Executive responsible for business development in Shreddit's healthcare vertical. We'll be providing some background information to ensure we're all on the same page, or in this case, slide, defining some key terms and concepts, then moving to how to comply and what happens if you don't, before wrapping up with best practices. Before we do that, let's take a look at some facts, some of which shocked me. Taking a look at these infographics, you can see that this is still a pretty big issue, but it's still not identified as a priority in healthcare setting. If you take a look, 70% of hospitals say protecting patient data is not a priority. Well, I'm sure it is a priority, but given everything else that healthcare providers have to contend with these days, it sometimes takes a back seat to some of the other initiatives they have underway. Yet a majority of hospitals have had multiple breaches. Many had no idea that they occurred, and others still didn't tell anyone despite an obligation to do so. Let's take a look at what is HIPAA. HIPAA is an act that came into effect in 1996. It's the Health Insurance Portability and Accountability Act, and HIPAA requires all healthcare organizations to put measures in place to prevent intentional and unintentional breaches. Intentional being where somebody goes out of their way to intentionally disclose patient health, protected health information, and unintentional is where accidents and mishaps occur either by lapses in process and procedure or otherwise where information gets out into the open where it shouldn't be. The Act talks about terms called reasonable and appropriate. Well, reasonable and appropriate come into effect. You could think about it as you can either lock up your organization's information like it's Fort Knox, but sometimes the cost of doing so is prohibitive and not necessary, and you may want to look at it in a more practical sense and take a reasonable and appropriate step to ensure that you have a defensible program in place for protecting health information. The Act also talks about technical and physical, technical being IT measures to protect information, and physical being lock and key and physical processes that you put in place to make sure that information is not breached. Later in this webinar, we'll discuss the privacy rule and the security rule and how they pertain to protecting information by standardizing rules. Let's take a look now at HITECH. HITECH, the health information technology for economic and clinical health, is quite a mouthful, and it includes rules that impact organizations that operate within HIPAA legislation. In 2009, the HITECH Act came into effect as part of the Reinvestment Act. This act was the start of the mandate for meaningful use of technology. This means electronic medical record systems and the like. And it requires security measures to address confidentiality and availability of data. The updated act now has more teeth and holds both the covered entity and their vendors accountable, their vendors being known as business associates. And the key changes include stricter regulations, larger penalties, inclusion of business associates, as I mentioned, and greater visibility. And this greater visibility comes in the form of mandatory notification of privacy and security breaches. At this point, I'd like to hand over the webinar to Chris, and he'll take us through some more information about major changes within HITECH, as well as key terms in HIPAA and HITECH. Chris?
Thanks, Andrew. Let's talk about some of the changes that have been brought on by HITECH since the year 2009. First, enforcement has become more proactive. We now have stricter audits in place to protect personal information, and since the enactment, business associates as well as covered entities are now required to comply. HITECH now addresses stricter fines for willful neglect, which we will be discussing a little more in depth later on in the webinar. Now we will take a look at some key terms that you may hear when discussing HIPAA HITECH. Knowing the difference between PHI and EPHI, who are covered entities and who are business associates. What is the security rule and what is the privacy rule? What is common control and the definition of willful neglect. First, let's look at PHI. PHI is protected health information. In most cases, you will find or see more of this in terms of paper-based records and information. EPHI is the protected health information that has been converted in some way to an electronic form. This next slide will show some of the most common forms of PHI. Keep in mind that there are two definitions to PHI. These statutory definitions are health information and individually identifiable health information. Health information itself means any information, whether oral or recorded in any form that A, is created or received by a healthcare provider, health plan, public health authority, employer, life insurer, school or university, or healthcare clearinghouse, and B, relates to the past, present, or future physical or mental health or condition of any individual, the provision of health care to the individual, or the past, present, or future payment for the provisions of health care to an individual. What I have seen in the past is that providers might do a good job controlling the paper and electronic side, but fail to use a proactive measure in controlling what is said verbally in the office or the clinic environment itself. Other terms you may hear will speak about covered entities and business associates. Who are covered entities? Some examples include healthcare providers such as doctors, dentists, therapists, psychologists, pharmacists, healthcare clearinghouses, and health plans. And as far as some business associate examples, this can be found as an IT service provider, a lawyer who's assisted you and had access to your medical records, a third-party administrator, or even a CPA who had access to healthcare information. These two groups of people are very much a part of HIPAA HITECH. With the implementation of the HITECH Act, service providers to these parties, BAs, also must comply with HIPAA legislation. Healthcare providers and covered entities are required to comply with HIPAA standards as well. Under the HITECH Act, the new obligations are mandated by law with civil and criminal penalties. Covered entities need to make sure that their providers are in compliance, or this can be seen as willful neglect. And speaking with providers, I have found out that some of them know their business associate, but do not necessarily have a business associate agreement in place. Now let's talk about the privacy rule, which focuses on protecting the usage, transmission, and storage of PHI. As stated by the HHS, the HIPAA privacy rule establishes national standards to protect individuals' medical records and other personal health information and applies to health plans, healthcare clearinghouses, and those healthcare providers that conduct certain healthcare transactions electronically. The rule requires appropriate safeguards to protect the privacy of personal health information and sets limits and conditions on the uses and disclosures that may be of such information without patient authorization. The rule also gives patients rights to their health information, including rights to examine and obtain a copy of their health records and to request any corrections. The security rule establishes national standards to protect individuals' electronic personal health information that is created, received, used, or maintained by covered entities. The security rule requires appropriate administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of electronic protected health information. What is common control? This can be seen as a situation where a covered entity has indirect or direct power of influence over another entity's actions or policies. It places the onus of this covered entity to ensure that the outside business associate they have contracted is taking necessary safeguards and actions to protect PHI of individuals. Now, willful neglect is defined as a tendency to be negligent and uncaring. Neglecting responsibilities and lacking concern or being uncaring may not sound different to the ear at first, but when you cannot explain what actions you took to prevent a breach of PHI and facing fines for a possible breach, it may come into focus a lot faster. Now I'd like to welcome David, who will go into how organizations and individuals can comply. David?
Thank you, Chris, and good afternoon, everyone. In speaking about how do organizations and individuals comply, it's the responsibility of the covered entity to explore and ensure the proper safeguards and procedures are in place when it comes to securing your protected health information. The Department of Health and Human Services website actually provides up-to-date guidelines and information that you can use in your educational and training needs. It's important to be aware of the rules and the penalties by educating yourself, and you should do this in an ongoing manner as your organization implements compliant practices. Additionally, all of your business associates who you contract with that have access to the PHI you create also need to adapt a practice of culture and compliance. So why is compliance important? Well, first and foremost, your patients expect it and they deserve it. It is a responsibility that they entrust to their healthcare providers, and they have an expectation that their personal health information is secure and secure from potential breaches. As a member of the healthcare industry, you have an obligation to ensure that. Secondly, compliance is extremely important to your respective organizations as well. Just the reputational risk associated with a publicized breach of protected health information of any size could be devastating and expensive for any organization. In fact, well beyond the cost per total violation, the potential could be in the seven-figure range. The goodwill and trust of your patients and customers that can be lost in just a single incident can become unrecoverable for your organization. Okay, moving on to what happens when you don't comply. Well, if you don't comply, the upside is that there is no upside. HIPAA and HITECH compliance is mandatory in the U.S. for healthcare providers, billing organizations, and insurers. In fact, as time passes, the penalties continue to get larger and the enforcement efforts become more public. A security breach of protected health information is not something you want to take lightly. So security breaches, we talked about that. What is a security breach? Here's just one example. This was actually the first situation that fell under the HIPAA breach notification rule, which states that you must notify any affected party whose information was breached. The HIPAA breach notification rule was established as part of the HITECH legislation in 2009. The cost of this effort alone is likely to cost an organization thousands of dollars. This illustration is from one of the largest penalties associated with HIPAA and HITECH, and this company spent almost $17 million attempting to rectify this situation. So penalties, and what are the penalties? The penalties associated with HIPAA and HITECH vary based on the level of intent. The chart you're looking at now overviews the offenses a person might commit, the associated fines, and even the imprisonment that could be levied as a result. This is worth noting here that enforcement of these acts is becoming more widespread. In fact, the Department of Health and Human Services has actually begun educating many state attorney general offices in the proper policing and enforcement of this legislation. Now it seems that I've covered the not-so-pretty elements of this very important legislation facing the healthcare industry. I'll turn it back over to Andrew, who will highlight some of the best practices that we have helped to design for your organization's compliance efforts. Andrew?
Thanks very much, David, and thank you for creating some sense of urgency for us, and thanks to Chris for the grounding on information. We're on the home stretch now, and I'm going to take you through some best practices to help with compliance. Certainly, the number one is proactivity. It's the key. The framework of identify, mitigate, monitor, and revisit is, pardon the pun, the prescription for security. Taking a look at the best practices, we'll go through 7 points I'd like to share, starting with staying informed. You can learn about HIPAA and HITECH and other privacy laws that impact your organization and how to stay compliant. And one easy way to do so is by accessing the Department of Health and Human Services website. It's loaded with support information, as well as accessing Shreddit's website. Our resource section has a ton of information that can help you and your organization stay informed. The next would be to establish a security plan. You know, the best organizations document the flow of confidential information and make sure that they have a formal security policy in place to guide their employees. And one of the rules, or things to keep in mind, is if it isn't written, it really isn't a plan. So make sure it's a written plan. The next would be to practice what you preach, education and enforcement. Training your employees is as easy as posting information, hosting webinars, and the good old-fashioned lunch and learn. And then updating them regularly, providing additional information, new information, to keep this concept and the idea of security at the forefront of your workplace. And then thirdly, enforcement comes in the form of monitoring the compliance efforts and helping your employees to see the progress in their efforts to be compliant. The next best practice that I'd like to talk about is certainly one of the hallmarks of security, and that is limiting access. Limiting access means ensuring that information is available only to those people in the organization that need access for their jobs to access that information. It's establishing policies, rules, and procedures to restrict access to only those who need that information. When it comes to creating a retention policy, this is a best practice that can lead to protecting your organization from legislative concerns. The last thing your organization needs to worry about is to have a breach of information that should have been destroyed a long time ago according to a retention policy. The next thing we should talk about is eliminating risk, and when it comes to shredding, simple solutions such as a shred all policy can go a long way. A shred all policy means that you remove from the employee's decision-making process what is and what is not confidential, and everything goes into the shredding container for destruction and eventually gets recycled as well. And last but not least is having a secure destruction program in place. Partnering with a knowledgeable industry leader that specializes in secure information destruction is key. And with that, it's now time for a little bit about Shreddit before we take some questions. Shreddit is the trusted leading expert in document destruction since 1988. We've grown to 140 branches with service to nearly 200,000 clients on 5 continents. And while we're a global company, we work locally supporting our clients. The process is pretty simple. You place your documents to be shredded inside our securely locked consoles. Only our security experts can remove your documents. Our handheld technology ensures that we empty each console at every visit, and it's documented with a chain of custody. We destroy your documents inside our truck right at your location, and you can watch the process. We offer multiple shred sizes for added security to meet your specifications. And after each service, we provide you with an official certificate of destruction. We recycle 100% of shredded material, making your company greener. At this time, I'd like to thank you for joining us today, and we hope that this has been helpful, and we welcome your feedback and your questions. Operator?
Thank you. Ladies and gentlemen, if you'd like to ask a question, please press star 1 on your touch-tone phone. To withdraw your question, please press the pound sign. If you're using a speakerphone, please lift your handset before entering your request. Please stand by while we assemble the queue. As a reminder, ladies and gentlemen, if you'd like to ask a question, please press star 1 on your touch-tone phone.
Operator, are we live to read out some of the online questions?
Yes, go ahead, sir. Thank you.
Wonderful. Hi, everybody. This is Andrew again, and we've got lots of questions that have come in online. I think we have about 20 minutes in our calendar here to take questions, and if there are any questions that we don't get to by the end of our session, we will be sure to follow up with an email to all of the attendees. Some of the follow-up questions, as well as many of you have asked about slides and whether we'll be sending those out. So yes, we will send a PDF of the presentation out to the attendees on this call. The first question that we have online would be from Laura from New Jersey, and I'm going to ask David to answer this. Laura's question is, can patient SINs, or not their SINs so much as their social insurance number, appear on medical lab reports? David?
Hi, and thanks for the question, Laura. The answer is yes, it can appear on a medical report, but currently most covered entities are encrypting that information just to take that one extra step to make sure that they're protecting what most Americans in this case see as the most viable part of the piece of your identity that can be taken. So in a lot of cases, we've had customers and clients and prospects who have asked that question, and in most cases, the larger entities have begun that process. And going forward, it seems to be the way that everything tends to be moving.
That's great. Thanks, David. The next question that we have online is from Linda from Massachusetts, and I'm trying to look up where people are from without giving all their details away. But one of the questions that came up is, would Shreddit be considered a business associate? And I'll take that one. There are a couple of clauses and pieces of information in the legislation that suggest that if the work is completed at the client site, that we would not be considered a business associate. Shreddit has certainly taken the approach that because we're an extension of the covered entity's business and performing tasks on their behalf, that we are a business associate, and we actually sign quite regularly business associate agreements. So whether it's 100% clear in the legislation how the work is done, leading to whether or not we're a business associate or not, we consider ourselves as such and sign off accordingly. Hope that answers that question. Next question. Do we have any online audio questions, operator, at this time?
Not at the moment. Thank you.
Okay, we've got lots more on the web. So I will, Kathy writes in, has HIPAA ever been preempted by state law? And I think I was going to assign that one to David. David, do you want to follow up on that one, please? David?
Sorry, folks, I was on mute there. Yes, Andrew, thanks. Has HIPAA ever been preempted by state law? The answer to that question is yes. Although HIPAA usually preempts contrary to state law, there are only 4 situations where the state law preempts HIPAA. Some of those exceptions would be, one would be in the case of state reporting laws, a health plan reporting and information gathering event, specific exemptions required by the HHS secretary, and then also whenever state health privacy provisions are more stringent.
Okay, great. The next online question we have, I'm not sure what the name where it came in from was, but is what is the minimum necessary, quotes, minimum necessary standard required? And Chris, do you want to answer that for us?
Sure, Andrew. I'll glad to answer that. Minimum necessary standard. Privacy rules require physicians make reasonable efforts to limit the amount of the PHI that the physician uses or discloses. And this might go back to kind of Laura's question earlier, that minimum amount, it's necessary, and less is better in this case. And we're always looking to accomplish the purpose of the use or disclosure of the information. It's important to understand that it doesn't apply when physicians disclose an information to another provider for a treatment purpose. So minimum standards are necessary, and it should always be exercised.
Okay, great. Thank you very much. Hope that answered that question. Next question we've got is from Buddy in Florida. And the question is Shreddit PCI compliant? Payment card industry data security standards is what Buddy's referring to. Many of the PCI controls will cross over into HIPAA HITECH. So great point, Buddy. And the answer is, I'll take that one, is absolutely Shreddit is PCI compliant. If one thing to note is if you go to the PCI data security standards website and you take a look through there for compliant vendors, there are different categories, and Shreddit does not show up on the website because the only categories of compliance that show up there are those that have been audited by the council that runs PCI compliance. And that's based upon the number of transactions that the organization, in this case Shreddit, transacts on credit cards, for example. So we are, while we're a pretty good-sized company, as we described earlier, we're not big enough to be on the radar of mandatory audits. We are a self-reporting organization, and we can send out some further information to the attendees of this. The second part of your question is, or comment, is that PCI controls certainly cross over to HIPAA. They absolutely do. So there's 2 points. One is how we handle credit card information, and the other is how we handle the covered entities information that may have personally identifiable information on it. And in both cases, we are well in compliance. I hope that answers your question. And again, we'll follow up with some additional information as an attachment to the follow-up that goes out following this webinar. Okay, we have a couple of other questions. There's another one here. Are there any on the audio line, operator, at this point?
There are no questions on the phone lines at this time.
We've got lots of online people, so that's great. Another question from Laura in Laura was in New Jersey, pardon me. Her question is, and I'll field this to Mr. David Pinter, when faxing laboratory patient reports to an ordering physician, is it required to verify the fax number, meaning that you're actually sending the PHI to a place that is supposed to be receiving it? And if so, what is an acceptable practice? David?
That's a very good question. The answer is yes, it is your responsibility to verify that you're faxing it to the right phone number. And there are some state laws that actually preempt. This is another case where some state laws might preempt the HIPAA legislation as far as penalties. From a HIPAA perspective, there's not a penalty involved in doing that, but it is an infraction. So it would be something that you'd want to check. I know that we have several fax numbers that we get that we've received even at our offices where we receive protected health information from covered entities around the country. So it is important that you do that, but it's not something that at this time that is covered as far as from the penalty phase of the HIPAA legislation.
Okay, great. A few more questions have come in online requesting copies of the presentation. And folks may not have heard me earlier, we will definitely make the slides available in a PDF format as a follow-up to all attendees in the webinar. The next question we have comes in from Maria, and Maria asks, that's the same question for more for the slides, absolutely. And I think we are covered in terms of all the questions that have come in. Yeah, I think we're caught up. So if there's any additional questions, I'm just going to hit refresh to see if there's any more, but if there's any additional questions, please go ahead and send them in online. Or, operator, do you want to repeat how to log a question while I just take a look online here?
Yes, thank you. So, ladies and gentlemen, if you have a question, please press *1 on your touch-tone phone.
Okay, we'll wait a moment for that, and then I'll go back to the web. We've got a few more minutes still. The next web question I have is from Deanna, and Deanna asks, is a document with just a name and address but no medical information considered PHI? And we'll follow up with a tighter definition that we can pull out of the legislation, but whether it's PHI or simply personally identifiable information, whenever you have information that is someone else would be able to use for various negative reasons, of course, it's called personally identifiable information. You wouldn't want to associate the person's name, in this case per your question, with their address, because that would be in conflict of many privacy legislations. So the short answer would be yes, that would be considered personally identifiable information, and we'll follow up on whether it strictly breaks the PHI rules. My sense is the answer would be yes. Does anybody else on the team want to add to that, please?
Well, Andrew, this is Chris. So when it comes to information like address and name, you're going to want to pay attention to what your state law might suggest in protecting, as you had indicated, personal information. I know up in Massachusetts they've got a law, 201 CMR 17, that protects all that information. So it's for the protection of the citizens of the state, and what the law does is it protects that individual wherever they go. So in some cases, if you're a medical practice in another state and you're taking care of a patient from Massachusetts, you would have to comply with Massachusetts state law as well. So to your point, I believe when it comes to personal information, it dovetails and adds on to what should and should not be disclosed. Hope that helped.
That's great. Thank you very much. We've got a flurry of additional questions that have come in, so I'm just going to scan through a couple of them. David, I just sent you one. I'll ask you to touch on, please. It reads, if you are a business associate and your client, or your client, the CE, the covered entity in this case, is in another state, what state law do you follow to determine preemption? Is the one you are in as the business associate or the state that the covered entity is in? David?
That's a good question. I think Chris just kind of alluded to that as well. You are responsible to comply with state laws. If your patient is in a different state, you are compelled to comply with state laws in both states. HIPAA obviously will override both laws in most cases, so you're going to be compliant with that piece of legislation anyway. But if there is a state law and the patient is a resident of a different state than you're practicing in, then you need to comply with both.
Okay, great. Thank you very much. The next question we've got is from, let me just see here. Deanna asks, to keep updated on new HIPAA regulations, you mentioned some resources other than the Shreddit website. Could you please repeat those resources? And certainly we'll send that out afterwards. The one during the webinar that was mentioned is the website for the Department of Health and Human Services, and we'll send that in a follow-up. Oh, thank you, Nicole. If you folks are online, you can see the website. The slides still. They're in the presentation that we'll send out. So there's several different sites that you can go to. There's 5 listed. So take a look there. The next question we've got from Jim is, what is required for emailing client information? And David, I think you've touched on some of that in the facts, so why don't you just spin the similar answer or any additional pieces relative to emailing of client information. David?
Well, it's the same. It goes back to the same as faxing. It's if you're sharing confidential information or protected health information in this case, and in the case of emailing, it becomes EPHI. The same rules and regulations are going to follow that. You need to make sure that the email addresses that you're sending things to are also, in most cases, business associates, so that they are complying with the HIPAA legislation as well.
Great. Buddy has written in a question that says, and this is going to go to David as well. Sorry, Chris, don't mean to leave you out, but this one goes right to what David spoke about during the webinar, and that is, what are the advantages to be HITECH compliant? So, David?
Well, HITECH compliance is making sure that all of your electronic information is being processed in a safe and secure way. So, from our perspective, the biggest advantage is to make sure that you're protecting the PHI, the EPHI of the patients that you serve. And also that you're avoiding the penalty phases of the HIPAA legislation and any penalty phases that might become as part of, as I mentioned, Attorney General offices around the country. Those offices are also hot on the trail of high-tech violators. They're using their resources to assist the Health and Human Services Department in a lot of cases to make sure that that covered entities are following the law.
Okay, great. The next question I'll send towards Chris, please. Chris, the question came in, is some form of hard drive encryption required by the HIPAA HITECH legislation, or is it something that is suggested? So is there encryption required, or is it more of a suggestion?
Well, as far as encryption goes, as everyone believes, you want to take all the necessary steps. Most recently, I believe it was just this morning, a healthcare facility in Georgia is facing a fine of a class action lawsuit of $200 million, all because of 10 backup drives not being encrypted. So I guess you really want to value, necessary steps in the sense that you do not want to be on that end of a class action lawsuit of $200 million for not being encrypted. And David, if you want to add to that, please feel welcome.
No, I think you covered that well. Thanks, Chris.
Great. Thank you for the question, Buddy. Operator, are there any questions on the audio portion?
Yes, there are. There's a question from Dr. Mergat, and Dr. Mergat is from Maximum. Dr. Mergat, please go ahead.
Oh, hi. Thank you very much for the chance you're giving me. I do have a couple of offices, and we do have a sister company. So this will be a very good eye-opener for everybody to know. You got to set up HIPAA confidentiality agreements between the sister companies. If any of the nurses, they are going to hospice or home health, or they are doing a DME, or they have something to do with the lab, drawing the blood. So they have to have some kind of a confidentiality agreement signed among them.
Thank you very much. So your suggestion is that there needs to be a business associate agreement signed between sister companies or related companies.
Correct.
Well, thank you for the input. I'm sure that's, and just for everyone else's sake on the phone, we'll double check some of that information, and when we reply post-webinar, we'll post Dr. Mergat's question and his answer or his comments and a formal reply on that as well.
Thank you very much.
Thank you for the question or the comment.
Thank you.
Operator, are there any other on the audio portion?
There are no further questions on the phone line, sir. Please go ahead.
Okay, we've got a couple of more minutes, so there are a couple of additional questions that have come in on the web. So we'll spend a few more minutes till about 1:45 the hour, 15 minutes before the top of the hour, and then we will wrap up. And again, any questions that we don't get to during this session, we will answer and follow up in the email that goes out afterwards. So the next question that came in from Steve is there any type of document available online that lists high-tech requirements in easy-to-understand terms? That's a great question, Steve. David, why don't I field that send that to you, but before I send it over to you, there are at the end of at slide 25 in what will come out to you after the call has 5 sources that you can go to. In addition, the first one is certainly Shreddit's legislative fact sheets, and quite frankly, they're written fairly well to be pretty simple and straightforward, but certainly they are focused on how you deal with things in terms of disposal, confidential document disposal. So they're a little focused that way. But in addition to that, there's 4 other websites that will provide you some information. David, do you have any favorite sites that boil it down a little bit more than maybe the Health and Human Services one does?
Well, obviously, because Steve asked that question, he's probably been on the HHS.gov website because it's not that user-friendly, unfortunately. It is getting better, so that will happen. As far as a favorite website, yeah, the second one listed on the list that you can see, the healthcareinfosecurity.com information there. If you go to that website, and you can actually subscribe to it, and they'll send you daily or weekly updates, whatever you choose, and it gives you a wealth of information as far as not only as how HIPAA and HITECH work with protected health information, but also in other parts of your business and your organization. So that's my favorite one, and you'll find webinars and what they call call sheets, where they give you really definable, easy to understand information that you can pull up. There's a lot of white papers as well that other organizations have shared. So that's always the one that I push people toward. Thanks, Steve.
Okay, great. The next question, I think it'll be the last question that we have time for. Chris, I'll ask you to take a look at first, please. Comes in from Buddy, who's got a bunch of good questions and comments, so thank you for your participation, Buddy. Do military organizations and clinics have to follow HIPAA HITECH? Chris?
Well, thanks, Andrew. And Buddy, it's a great question. You know, when it comes to military, every individual of the military is still a citizen, and information still needs to be protected. So most military facilities are exercising, to the best of their abilities, the proper steps into the protected health information. And I've been to a few of them myself, conducted audits, so the necessary steps are being taken. David, I'm not sure, you know, what you've come across personally yourself and some of those facilities that you might have seen or audited yourself.
Yeah, the same. We've done a lot of work with Humana Military and a lot of other companies that are health maintenance organizations and healthcare providers for the military, and including some of the national accounts that we've sponsored. And all of them are required, as you said, they're all required to comply with all state laws and with the HIPAA laws that preempt those.
Great. Sounds like that would be one that we would do well to. I think we're pretty comfortable with the consensus that the answer is yes. But we'll take a look into that for you, buddy, and put that in the follow-up questions. Closing up, and I want to say thank you to everybody for attending. Deanna, we got your email, and we will add you to the email list. And Karen, thank you for your comments. Her comments were thank you for your information, very helpful. So we appreciate those. And certainly in the follow-up, if there's any additional questions or comments that you wish to share, we'll provide how to do so in the follow-up email. So in closing, I'd like to thank everyone for joining us today. We hope this was helpful in improving your understanding of how HIPAA and HITECH legislation affects organizations that handle protected health information. And we hope to have you join us at another Shreddit webinar soon. So thank you very much. Operator?
Thank you. Ladies and gentlemen, this concludes the conference call for today. We thank you very much for your participation. You may now disconnect your line and have a wonderful day.